and be symptomatic. And we said that once a patient becomes symptomatic from choledocholithiasis, it's now called gallstone disease. And when does that happen? Gallstone disease. Go back to the very first choledocholithiasis video and watch. We explained this in detail. But basically, someone who gets a stone that sits here, and then it's like sort of like it sits there at the mouth, then it has got a chance of coming back and rejoin the other stones. So the symptoms are on and off. But that's the first area. But if the stone comes and sit here, a patient, this stone cannot come back and rejoin this stone. It's stuck there. Then this patient will develop, because of, go and watch again cholecystitis video. So the patient will get cholecystitis. And then if this stone happens to be so big that it compresses on this common hepatic duct, that's called Mirizzi syndrome or Mirizzi syndrome. So this patient is going to present like a patient who's got choledocholithiasis, which we're going to talk about. So it's Mirizzi, this is an R. So a Mirizzi syndrome is a stone that is in the cystic duct but compresses the common hepatic duct. That's a Mirizzi syndrome. But if this stone manages to pass and then get stuck here in the common bile duct, then that's called choledocholithiasis. Choledocholithiasis. We are going to talk about these choledocholithiasis. We are going to talk about the complications of choledocholithiasis, which are acute cholangitis and gallstone pancreatitis. Okay, so that's when now you've got a stone somewhere here. When you've got a stone here, it means the pancreatic juice and the enzymes won't make it to the duodenum because of this obstruction. So the enzymes that are secreted by the Acini cells into the duct, those enzymes are normally inactivated, but the longer they stay there because of the stasis, they start to be activated, and then they start to digest the pancreas. And this patient will have a high lipase and a high amylase. We're going to talk about those things. So that's what is called gallstone pancreatitis. Now, if you have a situation whereby this stone manages to, let's say we've got our small intestine like that. So if any of these stones can manage to, let's say this same stone manages to get inside here through a fistula. This fistula is normally called a biliary enteric fistula. Biliary enteric fistula. So if that stone manages to get inside here and for some reason gets stuck at the small intestine, the ileum, that's called gallstone ileus. So this stone is going to